So this video is going to be more about disc pain in the lower back. So the discs are basically cushions. They're ligaments technically, and they have an inner surface called the nucleus and the outer surface called the annulus, and they're basically shock absorbers. They're preserved by a good functioning curve in the lower back called a lordosis. We'll see a lot of people who lost the curve in their back will definitely have more lower disc degeneration, wear and tear, and also herniations. So what happens is when you lose that shock absorber, all the load, everything is put through the disc, and instead of shared a little bit through the joints in the back called the facet joints. So when a person's disc begins to fail, bulge, or herniate, essentially what's happening is the material on the outside called the annulus is starting to break down, and the inner material called the nucleus is starting to ooze through or push through. So disc pain is generally made worse when a person sits. So if they're sitting for any length of time, that's going to aggravate that. It's going to also cause pain to hit the nerve if the disc is bulged enough. I'm going to take that off and see if we can get light back. All right, I don't know why I did that. Anyway, so when the disc bulges, it can cause sciatica, but it can also cause discogenic pain, which is a pain sensation of its own in different places like the buttocks or legs. Sciatic pain always travels down the back of the leg. It goes down through the buttock and then through the back of the leg and then down into the calf or the outside of the leg or the back of the calf. So disc pain is actually made worse when you bend forward because it's squeezing the disc backwards into the spinal canal and putting pressure on the nerves. Disc pain is also made worse if you're driving or sitting and you're in some kind of device, a mechanical thing, a bucket or something that has a lot of vibration. They have a lot more disc pain and things of that nature. If you have increased pain when you cough or sneeze or move your bowels, or if you straighten your leg and you feel increased pain, that's very likely disc-related pain. Some of the telltale signs are if you're sitting at your desk and you go to get up and you have a lot of pain, or you have pain down the back of your leg. That's probably disc pain. A lot of people will think it's piriformis syndrome. That's been thrown around a lot. It happens. It's not super common. I would say it's 80-20. So if you have sciatica, 80% of the time it's probably disc. 20% of the time it might be something like piriformis syndrome, or one of the external thigh rotators in the buttock could be causing that as well. So disc and nerve go hand in hand. It's a separate animal. There's a certain way to treat it. So the best way we find to treat it is to do some gentle traction, which is to kind of pull the spine apart and allow the fluid and everything to reabsorb back into the disc. Certain exercises and stretches are good for discs, and certain exercises and stretches are bad for discs and can actually make you worse. So depending on what type of back pain you have, that's going to dictate the type of treatment that you get. So if you have facet joint pain, you're going to be treated differently than if you have disc pain. Or if you have SI joint pain, it's going to be treated differently than disc pain or facet joint pain. Most of the time, if you've had a complicated lower back, you may have some or all of these components at the same time. And so you might be thinking, oh, it's just a disc, when in fact it also is your SI joint and your facet joint, which makes things a lot more complicated. But disc in and of its own, most of the time, overwhelmingly, it does not require surgery. So the single biggest thing that you can do to avoid surgery is to try to be patient. There are things we look at clinically that determine whether surgery should be looked at or not. Some of those things are if you have good reflexes, if you have strength in your toes, you can bring your toe up and down, if you can walk on your heels and toes, if you have sensation in your legs and feet, then more times than not you can avoid surgery. It's incredibly painful. It can take a long time. It can be aggravating, frustrating, and it can be very fickle. You could do great on Monday and on Tuesday be terrible. So you have to listen to the instructions. You have to be careful doing certain things. Bending, lifting, twisting are the worst. The bad thing for discs is that what's called couple motion, where you bend and twist at the same time. that causes a lot more disc problems. So disc problems can be very tricky, like we said, but there are treatments for them. They are effective. It does take a little time, but more times than not, you can get through this process without surgery, provided that you have full neurological function and you've been evaluated properly. I treat patients when I look at somebody. I always want to look at a weight-bearing x-ray of them, because that tells me what the general shape of the spine is in terms of how much wear and tear is there, but also, does it have a functioning curve, a functioning lordosis? If it's straight like that, I know that this disc is going to fall under a lot more stress over and over again, and so we might try to reestablish a normal curve in there. This is all explained when we take an x-ray and we sit down with the patient and we explain this to them. So that's disc. We're going to talk about facet joints next.